The Community Mental Health Center system in Kansas has over 70 years of history providing state-of-the-art, comprehensive outpatient services that delivers care to people from all walks of life in every county across the state. We have done this in partnership with federal, state, and county governments and created services at the envy of other mental health systems across the country. Because we have done this, we want to make certain all the partners continue their investment in community-based care. The faces, stories, and information that we are about to share illustrate the need to enhance partnerships, increase collaboration, and improve financial commitment to further strengthen and enhance the system.
I think our mission here is to really help each person achieve their potential.
People struggled unnecessarily for many years, and now fortunately we can help them if we can make it feel safe and comfortable for them to come forward.
For over 70 years, the Association of Community Mental Health Centers of Kansas has provided leadership for the state's local mental health care organizations. Our citizens deserve to find the least restrictive, lowest cost treatment options possible, no matter their social or financial status. We partner with elected county commissioners throughout the state. Counties provide many important services to their residents. Mental health care is just as important as safe roads and law enforcement.
Counties are kind of natural partners, I think, in a lot of ways, because counties have a lot of resources for social services. We have a health department, and we maintain that, and so it's a good avenue for distribution of information or for some prevention techniques or those kinds of things.
Access to treatment has been shown to reduce crime problems and ease the burden to our legal system.
I think that our court systems experience the downside of inadequate mental health care.
We see an awfully lot of our defendants that are in need of either mental health treatment or drug and alcohol treatment.
As the Association of Community Mental Health Centers of Kansas strives to provide support for the industry, we continue to face many critical challenges. Mental health cases equal the number of cancer cases in the U.S., but receive relatively little attention. In Kansas, we have seen a nearly 700% increase in caseload since 1994. Yet state and county funding sources dedicated to underinsured, uninsured, or those who don't qualify for Medicaid have remained virtually unchanged.
When I was younger, I knew that I had a problem, but nobody had ever listened to me. And I'd have a job for a while, and then I'd take off and hitchhike and travel. Sleeping under bridges, sleeping in dumpsters, dangerous things that normal people wouldn't do. I never realized how deeply flawed I was, how much of a problem I did have.
Larry became quite stabilized. He got a job. He got a house, a permanent house. It reached the point actually where we offered Larry a job as a peer housing specialist here at Prairie View, knowing that he brought a certain perspective that none of us could match, and we have found him to be an invaluable member of our team.
They were actually helping me get my life back together, and talking to me about staying put and not running and helping me get established. From being homeless to coming to Prairie View as a patient to going to work for Prairie View. I'm a guy that came in off the street too, so I can empathize with them, and things they had to do.
From the time I was 21, I was in and out of therapy. The depression got greater and greater and greater, and finally I reached a point where I knew if I didn't get some help from somewhere, I was going to die. When I got through most of the really traumatic stuff and the suicide attempts and finally got to a point in my life where I was a little more stabilized and able to, kind of go it on my own, the Guidance Center didn't just, say, well, you're okay now, go on your way. They continued to support me in any way I needed.
Debbie is just such a tremendous person. She has so much to offer, so much heart, so much love, so much care to give to others. And we've been able to provide help and support to her so that she can maintain employment, so that she can live a healthy life and to be involved in her local community.
I could not have done that if I hadn't had the support from the people at the Guidance Center. And they gave to me a chance at a better life, and my life has gotten better.
In Johnson County, our mental health center serves almost 10,000 people every year. So of those 10,000 clients we serve, probably 1,500 to 1,800 adults have a severe mental illness, and close to 2,000 children have a severe emotional disturbance.
These might be children that have been in several different daycare placements, and the parent is kind of at a loss as what to do next, so they might be calling the school and asking for help. They might not know how to access community mental health center, so they might be coming through the school first.
Well, as a mother, I was feeling pretty helpless in the situation. I had read books, I had asked other parents. It just seemed like any of the techniques that were working for other children were not helping my child.
In the therapeutic preschool, the case manager assistants will work individually with the children as well as in just group kinds of skills.
Not only was he getting help in a preschool setting, but he was also getting help at home and in the community.
We'll raise our hands for questions. We are ready for lesson time today.
Access to community-based mental health care is increasingly important. All Kansans live within reach of any of our 27 licensed centers and are served by the 4,500 professionals who work within the system. While our many goals continue to be met, the future is uncertain. It is critical, now more than ever, that county and state resources continue to match the need for care. Please help us meet the increased need for funding.
Mental illness is a disease, and it's a disease that can be treated just like any other physical disease.
One of the things that's exciting to see is that when a person's mental health needs are met, not only the healing that has occurred for them, but also the healing that occurs within families.
We need to be the voice for our clients whose voices won't be heard otherwise.
They were instrumental. I couldn't have done it without them.
Imagine that it was your mother or your brother or your son that was struggling from depression or schizophrenia. What kind of care would you want for them?